Psychiatric health is virtually looked away by both the social organizations and the political establishments in Pakistan. That is the reason the state and society has still a long way to go vis-a-vis developing sensitization towards significance of caregiving service to those vulnerable beings who are deprived of mental health. The long-awaited research on Sir Cowasjee Jahangir Institute of Psychiatry, known as CJIP Hyderabad, Sindh, evaluates the caregiving service and recovery and available rehabilitation facilities for the inpatients. The focus of the analytic research is the women's ward of the psychiatry, which portrays how psychologically distressed women live and recover in the undercared environs of the psychiatric hospital. This research is linked with one of the three focal themes of Shaheed Mohtarama Benazir Bhutto Chair, that is gender empowerment and gender justice. The chair aims to start a comprehensive advocacy plan following the research findings and contribute its portion of caregiving to the lives of the destitute souls.
It was a great pleasure conducting a research on Sir Cowasjee Institute of Psychiatry, Hyderabad Female Ward. I am thankful for a great contribution of Shaheed Mohtarama Benazir Bhutto Chair and particularly Ms. Sahar Gul for extending and enhanced support for conducting this research, which is much needed. Sir Cowasjee Jahangir Institute of Psychiatry was selected to work on as it is one of the leading psychiatric institutions rendering services to Sindh and Balochistan. As the only government institution providing such services, it comes to no surprise that even people from modern urban city like Karachi come for treatment at the institute. This research is designed to demonstrate the various ways in which the facilities provided at the hospital can be improved. It will provide a baseline for monitoring the challenges and aspects of rehabilitation at the institution. It will also help in creating policies and reform for the improvement of health services. In this research, structure of the hospital, services provided, facilities provided, care plan were assessed. Perspectives of doctors and patients about the rehabilitation process were also looked at. Several needs were identified, but it was found that there is a dire need of rehabilitation required at the hospital. Rehabilitation would help patients to be a part of society when they leave the hospital. The institute need to be similar to more home-like environment, rather only having a bed and a bedside table for the patients at the hospital. There should be a sitting areas with sofas, TV, magazines, games and many other things. Area of the hospital is huge and can easily be utilized to convert it into a home-like environment.
Primarily, the chair thanks Ms. Ambreen Griffin, the researcher of the project, who out of her passionate involvement in the subject, delved deep into the study and added quite a meaningful contribution to the subject as well as to the lives of the women. Besides that, the chair also thanks the staff of CJIP and especially Dr. Moeen Ahmad Ansari, Professor and Chair Department of Psychiatry at CJIP, who not only encouraged this research endeavor but also helped us in every step to conduct and accomplish this research with his expert guidance. The chair hopes this joint initiative would bring meaningful betterment in the lives of the patients of CJIP.